Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we're announcing one additional death due to COVID-19 and from the Winnipeg Health Region. I want to extend my condolences to their family, friends, and loved ones. The current 5-day COVID-19 test positivity rate is 3.9% provincially, 3% in Winnipeg. As of 9:30 a.m. today, 35 new cases have been identified, bringing our total to 31,894. Data from around the world has shown that COVID-19 infections are not evenly distributed throughout populations. Data has shown that Black, Indigenous, people of color are overrepresented in COVID-19 infections. Today we're releasing data on race, ethnicity, and indigeneity, from people who have tested positive for COVID-19 in Manitoba. Manitoba's data shows a similar pattern as other jurisdictions have reported, with African, Filipino, Latin American, North American Indigenous, and South Asian communities being disproportionately affected with COVID-19 infections. It's important to note that this is not about the people in these communities making bad choices or people not following public health guidance. We need to look at this data in the context of many factors, such as occupation, income, housing adequacy, to understand how race influences the effects of COVID-19. We know people in BIPOC communities are more likely to live in lower income neighborhoods, live in overcrowded and or multi-generational households. They're also more likely to have low wage occupations and be employed in higher risk occupations, such as food manufacturing, service industry, transportation, and accommodations, food services, retail. This is systemic, and it's seen in every jurisdiction, resulting in very similar patterns of the disproportional effects of COVID-19. Public health officials will work to improve access to more reliable data. This means increasing the percentage of times this question is asked and recorded in the Public Health Information Management System. In addition, public health officials will work to develop strategies to take action in partnership with BIPOC networks and community organizations. In the longer term, this includes introducing changes to health and social systems to strengthen protections and reduce risk. You can view the full report online for further information. A note about vaccine sites and eligibility criteria. COVID-19 vaccine appointments can now be booked for super sites in Winnipeg, Brandon, Thompson, and Selkirk. Eligibility criteria are expanding today to include individuals born on or before December 31, 1930, and First Nations people born on or before December 31, 1950. More details are available in today's vaccine bulletin. As we continue to battle this pandemic and monitor for variants of concerns, it's crucial we continue to avoid the activities that are known to cause the most risk. These are those closed spaces, crowded places, close contact settings. We know we can't open everything right away, and we're taking a slow and measured approach so case numbers don't increase in the weeks ahead. The reason some sites are not being considered for reopening at this iteration of the orders, such as movie theaters, is that these are areas where people leave their homes for non-essential reasons to gather for extended periods of time indoors with people from outside their household. So these are the higher risk settings. And so, again, we're not going to be dealing with this forever, but as we have our slow, cautious reopening, those higher risk settings are not being considered right at this iteration. I've received many emails asking why swimming pools were not allowed to open, so I just wanted to address that here, that the current public health orders do allow a number of locations to be open, which include swimming pools. However, sites may have chosen not to open for various reasons. So anyone could reach out to their, that particular location for further information, but it's not the public health orders that are limiting those. This weekend, police in Winnipeg reported an employee was stabbed after asking someone to wear a mask. So first, I want to extend my well wishes to that individual who was assaulted and wish them well in their recovery. This is very serious, thankfully very rare outcome of someone refusing to follow public health orders. I do want to offer my thanks and appreciation to business owners who are working so hard to implement these public health orders and working hard at the fundamentals. It's certainly been challenging times for many, but the efforts of our business community and all Manitobans is much appreciated. We have variants of concern now here in Manitoba. It remains crucial that Manitobans continue to follow the fundamentals, right? Washing hands, covering our cough, physical distancing, wearing a mask. Very important to stay home when you are ill, even slightly ill. So again, we've had many reports of cases having many contacts because they felt their symptoms were too mild to be COVID. We hear from many healthcare providers of people attending clinics thinking that it could not be COVID what they have because their symptoms are mild. So any of these respiratory symptoms, sore throat, cough, runny nose, certainly fever, aches, sometimes fatigue, even some gastrointestinal symptoms, prolonged diarrhea. So even these mild symptoms could be COVID. So stay home when you're ill, get tested even if you're not sure. It's our best way to try to keep our success with these numbers continuing to drop. We need to continue to avoid activities that are known to cause the greatest risk, crowded places, closed spaces, close contact settings. And this is the best way to contain the spread of COVID-19 while we're starting to vaccinate our population. We're going to continue to be cautious in approach. We do not want to open things up and then close and reopen again. We want to gradually reopen and stay open. Manitobans' adherence to the orders and fundamentals will continue to determine our next steps. Before I take questions, I want to take a minute to extend my congratulations to Lynette Siragusa, Chief Nursing Officer of Shared Health. She has received the Strength in the Storm Excellence Award from Nursing the Future. This award is for a nurse leader who has consistently overcome disruption, chaos, and turmoil during a global pandemic and recognizes the contribution, leadership, and steady hand of nurses in Canada who are stabilizing forces in their families, communities, and profession. I certainly can't think of a more deserving recipient than Lynette Siragusa. Throughout the pandemic, she's been such a fantastic leader at our incident command table, bringing tremendous ideas and solutions. She's been quite a leader and continued to even taking shifts at care homes during some of this pandemic. So certainly has been a my pleasure to work with Lynette, and is a tremendous asset to Manitobans, and we're really lucky to have her, and I want to congratulate her for this very well-deserved honor. So thanks again to all Manitobans, and happy to take some questions.
Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and one follow-up question this afternoon. Up first, from the Winnipeg Sun, Glenn.
Yes, Glenn Dawkins from the Winnipeg Sun. Today was the first day, I understand, of the rollout of the immunization for the general population, 95 and older. Can you give a comment on how that is going so far?
I think last week we opened up to 95 plus and have today been able to expand that. From the reports I receive, things have been moving slowly. The appointment system has been working well, and so we'll continue to be able to expand that as we receive more vaccine.
On the weekend, Health Canada talked about that they were hoping to approve the Johnson & Johnson vaccine. I believe it's in the next couple of weeks. Comment on that and any new additional information on the AstraZeneca vaccine rollout for Manitoba. Have you received any additional information on that as well?
I don't have anything more on AstraZeneca. It's certainly a welcome addition to our vaccine repertoire. And, a fourth approved vaccine will only add to our ability to vaccinate Manitobans. So we'll await Health Canada's ruling on Johnson & Johnson. And so, we look forward to receiving doses of any vaccine that's been shown to be safe and effective. And we'll continue to do our best to get Manitobans protected.
From CBC Radio Canada, Matthew.
Hi, Dr. Roussin. Why the Métis are not included with the other First Nation for the age from which they can be vaccinated?
Yeah, so the vaccine task force has been working with a number of stakeholders. They work with, certainly they have their table that they've worked with First Nations on here. So, I think that there are, a number of risk factors for the vaccine. It's a complicated rollout when you're dealing with scarce vaccine supply. So I think we'll, as we're continuing to roll out vaccines, as we continue to review eligibility criteria, I think there's, there'll be further updates. But I think I'll let the vaccine task force speak to specifics.
Okay, and what do you think of the fact that Métis President David Chartrand come into contact with the pharmaceutical to order his own vaccine?
Yeah, I'm not going to comment on, I think certainly they're going to, take action like other organizations to best care for their members as they see fit. I think that our vaccine task force has been tremendously organized and is rolling out a very challenging vaccine program due to logistics and scarcity of supply. And we'll continue to try to do it in the way that best, protects Manitobans.
From CBC Manitoba, Bart.
Hey, Dr. Roussin. Now, with this ethnic data that we're seeing right now, and especially the disparity that we're seeing with Filipino Manitobans and with South Asian Manitobans, what specific means, you alluded to in your preamble, what specific changes are going to be made from the public health side to try to improve those outcomes?
Yeah, and so there's been a number of things. So one is just the engagement to start collecting this data, how it would be collected, how it would be reported, is working with members of all those communities. We've been working on trying to have access to our information in many languages. We've, there's the federal income support for the people who are required to self-isolate. And then we've had a number of outreach areas in certain districts where we saw higher case numbers, many of them being the overrepresented groups on here. So things like rapid testing and contact tracing. So we're going to continue working with those groups, try to identify ways that we can further improve things. But I think the key is that we've been able to collect this data, we've been able to analyze it, and we're going to encourage that more of this data be collected so we can, hopefully still work with these groups to find better solutions.
I'm confused about the First Nations being pegged at 13% of the population. We know Indigenous Manitobans being pegged at 13% of the population. Total First Nations, Métis, and Inuit together is 18%, according to StatScan 2018. First Nations closer to 11%. What's that 13% number? Where's the? I don't mean to nerd out here, but are you excluding Métis from this list, or is this self-identification? What are we looking at here?
Yeah, I don't have the specifics on that, Bart. We can get you that. I think this whole report was a great collaboration through with the various affected communities, and so we'll try to see where we got that denominator from.
From the Canadian Press, Kelly.
Hello. The recommendation for AstraZeneca's vaccine is to only be used on those under 65. Can you comment as to that recommendation, as well as what that would mean for Manitoba if the vaccine arrives here?
Yeah, so a lot of that has to deal with the number of people in the studies that were above that age. Certainly in real life use, there's evidence showing that it's certainly safe in all ages, and that it is effective. A lot of these the data for the vaccine trials are looking at symptomatic illness. If we look at things such as severe outcomes, these vaccines are very effective. So right now with our program, we will continue to roll out the vaccines that we have, the mRNA vaccines, and we've been providing those to the most at-risk Manitobans. And like I said, AstraZeneca would be a welcomed addition to us. We'll continue just to follow the national guidelines on that.
And can you speak to whether we're on track in regards to the reductions in ages for general populations being able to access the vaccine? Are we on schedule with the age limits dropping again today?
I think for the specifics on that, I think I'll let the vaccine task force discuss that. I do think that this was in keeping with our plans, and again, our only limiting factor right now is the number of doses. So as we receive more and more doses, we'll be able to vaccinate more and more Manitobans and continue to open that eligibility criteria.
From CTV Winnipeg, Michelle.
Hi, Dr. Roussin. I'm wondering about the efficacy of AstraZeneca. People keep quoting the 62% efficacy rate. What do you have to say to people who are saying, hey, I might not want that because it's not as effective?
Yeah, and so I think that's when we look at the messaging behind this, it's a bit challenging. I think that we know that the AstraZeneca vaccine is safe, it's effective. There may be some effectiveness difference between that and the mRNA vaccines, but I think when we start seeing its use in various populations, we're seeing that the actual level of protection seems to be greater than that. And if we look at things like the protection it provides to severe outcome, hospitalizations and ICU admissions, we see it's quite effective. So I think we're going to follow national guidelines on this, and if used as we intend, we expect AstraZeneca to continue to provide a lot of benefit to Manitobans.
Thank you. Also, a question for you today about letting high school or ensemble bands continue to practice or resume practicing. Would you consider including that in the next round of public health orders? Because I know right now students that are in band can't practice together.
Yeah, so our public health orders don't apply to schools, so there isn't really anything in our public health orders per se that disallow this. But we provide a lot of feedback, a lot of recommendations to schools. So this is one of many topics that we continue to look at. Because we're really seeing good numbers, all because of Manitobans' hard work. And so we want to be able to loosen things up accordingly, but we want to do so in a safe and cautious manner.
From City News, Jonas.
Good afternoon, Dr. Roussin. Just want to touch base on some of this data that you've released on racialized communities. Just maybe a background on how long this work has been going on. What's gone in to collect this data?
So this is something that we worked on early on in the pandemic. I believe this is data spanning back to April, I believe. And so what we did was engage communities to see how this could be respectively collected and reported on. We've just included the question in our contact tracing, case and contact tracing process. And so it's a mandatory question that the public health nurses or contact tracers ask of cases and contacts. And then we, collected and analyzed it over time. We knew early on that BIPOC communities would be disproportionately affected, just as they are in other jurisdictions. So we really wanted to see the data, to be able to report back to our partners, and then try to use this to find solutions moving forward.
Just kind of touching base on, I guess, how this will be used again moving forward. I don't want to have you speak for the vaccine rollout moving forward, but is that an area where we could see this applied moving forward to eliminate some of those higher risk settings?
Yeah, well, I mean, we're continuing to look at the vaccine rollout and the high risk categories, keeping in mind the logistics and really the scarcity of vaccine. So I think overall the most important risk factor that we've seen is age, and so we'll continue to try to follow as much as we can an age-based approach to it. But for sure we look at all these factors and working with these communities to see what other approaches might be required.
From CHVN, Taylor.
Hi, good afternoon. Winnipeg Care Home says that they were told to count a death as a COVID death despite that person already being labeled as recovered from the virus. Can you just explain to us about why this is and a little bit more about what recovered means?
I don't have the specifics on this case, but we have a national case definition of a COVID death, and so if anyone who meets that will be listed as a COVID death. And so being recovered, just because someone is recovered doesn't necessarily mean they didn't die of complications from COVID. We know people are infectious up to about 10 days after symptom onset, but we know we have people still in the ICU because of the respiratory distress that COVID had caused. So they may be in there for weeks, so they would be listed as recovered. They're no longer infectious from COVID, but should any complications arise, it was still due to COVID that they were in that situation. So I don't know the specifics, but that's probably along the lines.
And can you tell us a little bit more about these prolonged symptoms, about the long haulers? What is the province seeing, and what's being done in terms of post, virus care, both now and in the future?
Yeah, and so it's still early. We're still learning a lot about these lengthy effects after COVID infection in people who have recovered. So it's not something that's reportable to public health. So public health doesn't have a sense necessarily on the proportion of people with persistent symptoms or issues. This is more of a clinical issue, so we have clinicians that follow people with these long haul symptoms. So, but we don't have a surveillance definition for that. So public health isn't regularly receiving reports of this.
Thank you.
From the Winnipeg Free Press, Katie.
Good afternoon. Can you give us an update on the contact tracing capacity now that case counts appear to be declining? How many contact tracers do we have, and how long is the process taking?
Yeah, so I don't have the exact numbers of how many contact tracers we have. We see, our targets really trying to reach contacts within that first 24 to 30 hours. We're typically meeting those that proportion. Same with contacts and cases. So we certainly have the ability to handle many more cases than we're seeing, and that was the idea, that if should we see increasing case counts, we'll be able to manage them through a contact tracing capacity. As we are seeing less and less numbers, we do find that a greater proportion of these cases are harder cases to contact trace. People who are underhoused, it's often hard to do a contact tracing protocol with that for a lot of reasons. So, a lot of cases we have that challenge as the proportion of cases declines. But overall, we're in a very good place for contact tracing capacity. We have the ability to do many cases than what we've seen. We have the ability to contact trace more numbers than our worst days in this second wave.
Okay. And can you give us any more data on the average length of stay in the ICU now for a COVID patient, and maybe just some more information about how those intensive care stays will impact public health decision making at this point of the pandemic going forward?
Yeah, and so the issue with the ICU admissions, we saw in the second wave about that 1% to 2% of cases would make their way to ICU. Most are recovering within that first week or two, but we see a certain proportion that require many weeks in the ICU. And so that's why we're not seeing, why we didn't see, a quick drop off with the ICU admissions. So we know that the hospital admissions and ICU admissions are lagging indicators. As we see cases come down, it'll be a lag for those numbers to come down, and vice versa. As we see cases increase, those numbers will lag behind our cases. What we find is that as our numbers are going down, ICU admissions lag even further, just because we see that certain proportion of individuals who are admitted there are staying many weeks in the ICU.
From Global News, Joe.
Good afternoon, Dr. Roussin. I just want to go back on to the question about band. So if I understand correctly, schools can, if they want, allow indoor band to resume because they don't necessarily have to follow the public health guidelines, correct?
Yeah, it's not as simple as that, because obviously they're working within a system. What I mentioned is that the public health orders expressly do not apply to schools. So it's not that they are limited simply by the public health rules, but certainly work with government, with education, and with public health on safe practices. So the public health orders don't exclude it, but they'll still be relying on public health advice for the most part.
Okay, so if a teacher is listening right now and wants to open band practice indoors, what would be the advice to them? And if it is do not to resume band indoors, why would that be?
Yeah, so the advice I would give is to go through the typical channels to receive public health advice and moving forward. So, right now we've closed spaces, prolonged times together. We know that certainly things like wind instruments, singing, and things can increase risk of transmission. So, we're working with this real cautious approach to try to ensure we can keep kids in school, to continue to open things up. And as our numbers continue to decline, we'll be able to do more and more of this. So with the specifics related to this, public health, education, we're all working together to decide what's the best way to approach this.
From the Brandon Sun, Michelle.
Good afternoon, Dr. Roussin. I know this question has come up likely too many times for your liking, but folks in the Prairie Mountain Health region are starting to feel, let's just say there's a wide range of descriptors. from anger to frustration to confusion to even loss of respect for public health. So I'd appreciate if you could walk me through all the factors that are keeping this region at level red despite our numbers. It's for a full story, sounds like fresh information. So if you could please walk me through the rationale from start to finish, including what PMH residents can expect in the coming weeks.
Yeah, and so I mean the rationale for the public health orders has remained the same, where we have people who gather, the more interactions, the more likely we're going to see cases. So I think Prairie Mountain Health has done well, have managed to lower those numbers and are doing quite well. We're just in the stages of our reopening plans in Manitoba. And why we haven't taken that regional approach right at this time is because of the mobility that we see. If we were able to put Prairie Mountain Health into, say, another level in the pandemic response system, have significant loosenings there compared to other parts of the province, we saw that earlier on in this wave. There'll be increased mobility into that region. And that brings with it more risk of the virus being reintroduced there. So right now, it's early on in our reopening plans. We haven't decided to use the regional approach with this specific iteration. However, that's always on the table, but that's the risk. The risk is if you go regional and you have a very significant difference between regions, the risk is that that's going to increase the mobility from other regions, higher risk regions, into that lower risk region, and thus reintroduce the virus. So we'll continue to follow it. This iteration isn't taking that approach. Doesn't mean that further ones won't still be looking at it.
Okay. Well, what do you say to someone who maintains that an entire region is being punished, for lack of a better word, for the past foolhardiness of some folks from other regions? I mean, some are saying we should be at orange, but looking at the definitions of color levels, one could argue we're actually at yellow.
So, I think that this pandemic's been challenging, right? And we're over a year into this. And so it's having an effect on all Manitobans. And so I would say that, these public health orders have never been there to punish anyone, right? We're there to limit the transmission of this virus, to ensure our healthcare system was there for all Manitobans. And so I think that these numbers are quite encouraging. I would say, again, we should, avoid anything that stigmatizes people. There's been people who have made mistakes, but there's other people who have caught COVID through really no fault of their own. And I think that moving forward, if these numbers continue, Manitoba is going to be in a better place as we move forward. We're getting vaccines rolling out. So again, it's not going to be forever. And certainly everyone understands how challenging this has been. But we're still at a precarious spot right now with variants of concern now in Manitoba, and we're starting to reopen things. We just want to keep those numbers down so we don't have to ever go backwards. So I would just encourage everyone, keep with the fundamentals for the time being. It's not going to be forever, but this iteration, we're not looking at the regional approach.
Thank you.
From CJOB, our final reporter this afternoon, Amber.
Hi. Now that things have been reopened for a little while, like restaurants and gyms, are we seeing community spread in these places, or where are we seeing community spread?
Yeah, so the number of cases that we would call community-based transmission, those that we can't necessarily say where they caught it from, have been diminishing as our numbers decline. So right now, again, most cases we're starting to see again the proportion of those cases being household contacts. But we're going to continue with things. We're just early in our reopening plans. The numbers have stayed favorable, which means we're set to continue with those reopening plans. But as we do that, we're going to be watching those settings very closely, watching where clusters may occur, and we'll have to respond accordingly.
Okay, and with the release of this race-related data, are you concerned about discrimination by releasing this information, similar to what had already felt in other groups before?
So this is one of the, the challenges about collecting and disseminating information like this, and it's why we've been really clear to state that this is based on systemic issues. We see this around the world where BIPOC communities are disproportionately affected, but it's really important that to note that it's not race that makes you more susceptible to COVID. It's the systemic factors that make you more susceptible. So things like we discussed, occupation, housing, income. And so it's very important that it's clear, that we made this clear. It was very important to our stakeholders that we engaged with this, that this is very important information to collect, to report on, to show that disproportionate effect. But we all knew that we had to be very clear that this didn't further stigmatize groups.
And once again, congratulations to Lynette Siragusa. She has received the Strength in the Storm Excellence Award from Nursing the Future. Thanks, everyone. This concludes our media briefing.